most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heinck, physical therapist.
Together, we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So we're going to show you today how to treat chest pain that is not a heart attack.
Right.
And Brad has had this experience several times.
Absolutely. I'm very familiar with this treatment.
Talk about experience. All right. If you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section because we're giving away the doozy of doozies today. We're giving away the Sleepovation mattress.
Not this one.
Not this one.
A
this
real
is a sample.
full one, yeah.
Yeah, this shows how it's made up of. So it's, they actually call this a hybrid mattress?
Well, yeah, of
because
course.
It's got coils and it's got foam.
Yeah, it's a combination.
Yeah.
It's just not all memory foam.
See the coils?
Yep, good for airflow.
It's breathable and yeah, it's cool. All right.
Oh, yes.
Go to bobandbrad.com, like I said, giveaway section, or go to Facebook. It'll be pinned to the top of the page.
Right
go
there.
to Twitter, Instagram, or TikTok if you want a 60-second version of our program. And what else do we have, Brad?
Well, Bob, we have the podcast out there in full force, and it's going wonderfully.
Can you get rid of this?
Absolutely.
All right. When you have chest pain, listen to me carefully. When you have chest pain, the first thing you do is you go to the doctor.
Right.
Immediately. Do not, this is unequivocal.
Which means you're probably going to have to go to the ER, emergency room.
Or ED, as they call them, emergency departments.
Right, yeah. I know because I've done this 3 times already.
Brad did it 3 times, and he's a therapist, and he's, even after you thought you knew what it was, right? You went back?
Yeah, they kind of made me, and my wife did.
Oh, she did.
I didn't want to. And then I also went to a cardiologist for a complete checkup after that. So anyways.
Right. So now, having said that, what they have found, and this we had Steve August on. He's a physical therapist from New Zealand.
Right.
And you may want to watch the show. It's on our YouTube and it's also on podcast.
Right.
He was the founder of this technique for treating it.
Right.
He found that he's done a lot of research on this, and he found out in most cases the chest pain is not a heart attack. In most cases, it is costochondritis.
Right. And oftentimes, like when I went all 3 times, they said your heart's, the 3rd time they said your heart's more healthy than all the workers in the ER.
Sure.
But they said it's musculoskeletal problem. I said, well, what do you mean? It's like, I'm a therapist. I should understand this. And they just said it's musculoskeletal. They didn't know either. They weren't familiar with costochondritis, and they couldn't give that.
Right.
So all doctors may not be familiar with it.
A lot of them may not be. And if they are familiar with it, they will honestly not know how to treat it.
Right.
And very few do.
And actually, Steve does do presentations to physicians to explain how he treats it, because he had it himself for 7 years.
Yes, he's a physical therapist, had himself for 7 years. So that when you have it, something when you're a therapist, you think about it, you mull it over, you work on it, and so let's first talk about some of the common causes of costochondritis, and then we'll explain what it is.
Mm-hmm.
Common causes, if you're in an impact accident like car crash, if you actually just have poor posture, what he calls the eye hunch, once the rib joints freeze up, you can't get them unloose unless you do a certain thing.
Right. And we're gonna show that on Sam the Skeleton. It'll make more sense.
Not unloose, loose. You can't get them loose. All right, next one, heart surgery. After they take those big
cut to the sternum, they open up the chest to access the heart.
Yeah.
And that's very understandable. There's a lot of trauma going on with those poor ribs.
Right. And the problem with that is, and I've had people have had that, Brad, and there's some anxiety along with that because they think, oh, is my heart having my heart attack? I was in surgery for that.
Sure.
So the other thing where a lot of people have anxiety is a lot of doctors will tell you this is going to resolve itself on its own.
Yep.
Usually within a year. Not true. They found out the average length of time that this lasts is 2.5 years. And they've had people it went on for 30 years.
Costochondritis.
Right. So what happens, he says, and I agree with this 100%, is people, they continue to have their chest pain, and the doctor only said it was going to last, 6 months to a year, and mine's still going on. maybe he's wrong about that. So maybe he's wrong about my heart.
Right.
So it causes all this anxiety.
Yeah.
So we're going to show you something you can try here that if it is costochondritis, it should 100% help.
Right.
So-
It's done wonders for me because I've had chest pain. I've zeroed mine down, like you say, for your therapist. You look at it more, and it's one of my lower ribs on the right hand side is where I typically get my pain. I think it was last summer, the last time I had it. I was mowing the lawn, and I wasn't doing my treatment consistently. Pain here, and it kind of radiated across. Sometimes I get it in the back on the right hand side. And it's not comfortable. It doesn't tear you apart. It doesn't tear me apart. But it's like I'm still thinking maybe I should go in again.
Right.
Maybe it's not Costo this time. I relaxed and actually did the treatment, and it helped. It didn't get rid of it, but it's like I
So
felt
do
better.
You need to do it preventively.
Yes.
Do you
Oh,
feel-
yeah.
You
Yep.
have to do it, and it's sometimes, as he describes it, it can be a sharp pain, very scary
Mhm. I
sometimes,
believe it.
and you can also hear clicking, popping, and cracking.
Yep. I've never
I don't know
had
if you
that.
had that.
Just the pain, and it's not sharp, but I mean, it had sharp, but it wasn't like a knife digging in.
Well, let's show real quickly what the cause is, and then we'll show how to
Yep.
treat it. So what happens is the pain is in the front, right here, where, like Brad said, Hugh had on the right side,
Yeah.
I've had on the left side.
Yeah. Mine was actually down here,
lower.
but it can vary.
Yep.
And mine also was in the back, and I think he mentioned that can happen too,
Sure.
but mostly in the front.
Yeah, usually right where the rib meets the cartilage,
Mhm.
and that's why it's costochondritis. But it's really not inflammation of this. Inflammation is secondary,
Yeah.
so there's not a infection or something like that going on.
Right.
So what happens is after the impact or with poor posture, these joints back here actually freeze up, and they're like little hinges, and when they freeze up, the spine, the whole rib cage has to move like a bucket handle. So it goes out. Brad, do you want to show that?
Yeah. So if we look at this, the rib, as you breathe in and out, this rib has to. I'm going to
Expand.
exaggerate a little bit,
Yeah.
but they're going like this all the time, and they have to pivot here. And if you can, are you zoomed in? Oh. So if you see the movement here, Bob, can you move that rib?
Sure.
And I'm going to point this out. So right here's that joint, and if that freezes up or gets some
Tight.
scar tissue,
Scar tissue, yeah.
gets tightened, adheres down, then what happens is the joint in the front,
The movement has to come from somewhere.
right? If it doesn't move back here,
It's
this
not moving
moves
back here.
more,
Right.
and this is not made to move more, so
Right.
it stresses the joint in the front, causes pain, and it just becomes worse. So when you breathe, especially if you maybe do an exercise that allows you to breathe more,
Right. Because I had a friend that got it with bicycling,
sure,
and he was bent over,
Yep.
and he was breathing a lot,
Right.
and he had really bad chest pain.
yeah. The first time I had it, I was throwing a football really
Which
hard
makes sense.
because
Yep.
these muscles up in here were really stressing this. Plus the costo and the breathing kind of multiplied
That makes
everything.
sense. Yeah, it makes total sense.
So the whole goal, I guess, we're getting to is we need to
We need to loosen up back here, even though the pain's in front.
right.
And this collagen, which is what is holding this stuff together,
Yeah, the connective tissue.
is really strong. They said stronger than steel wire, Brad.
Sure.
So I mean, you're not gonna. You can manipulate this, and it might feel better for a while.
Yeah.
So a chiropractor could go in there and manipulate it,
Yeah.
but it's gonna come right back again.
Yeah. It needs to be done on a more consistent
Yeah,
basis.
it needs to be done on a consistent basis, and it needs to be stretched. So what he does, he actually invented the back pod.
Right. Yeah. So I believe Steve himself actually came up with how am I going to do this to myself without
Exactly.
seeing another therapist or a chiropractor all the time to maintain the mobility.
Right. So now I think I'll mention this, Brad. You could try a tennis ball
Yep.
first,
Mhm.
especially with like a towel over the top.
Yep.
And what you're going to do is you're just going to lay on this.
Sure.
You're going to lie on it, right?
We had another English major. I think she really did a good job explaining. She was a little upset with us because we still didn't get it right. But
Really?
yeah, we better quit babbling.
We're going to
Bob.
lie on it. So, Brad, if you want to come here first real quick, I want to show where we're hitting.
Yeah.
So you could try, again, towel underneath here. You might even have a pillow underneath the head when you lie on it. But you can hit like 6 different spots here. I'm on the side of the spine, between the shoulder blades. The back pod, you can actually lie right on it.
All right.
You can
Now the reason that we put a towel there because it's a little uncomfortable at
Right.
first until you get used to it. But you want to show
yeah.
when I
So-
started, I used a towel to
On
cushion
this.
even
Yeah.
for about a week or so.
So I still go on the sides with this one. I don't go on the center. I don't know what you do, Brad.
I go on the sides.
You go on the sides.
I
yeah.
actually go in 8 spots instead of 6.
You really hit it a lot, huh?
Yeah, and people will figure that out on their own once
Yeah,
they use it.
and it comes with a really good booklet.
Yeah.
He explains it not only for posture, it works well for that, but
Yeah.
but also for the costochondritis.
Yeah, and there is even treatment for sacrum down lower.
Yep, yep.
So there's more than one thing you can use it for too.
So I'm gonna lie on it real quickly, Brad. Just
Right on the table
yeah,
here.
right on the table.
Okay.
It's not advisable. We wouldn't do it
Yeah.
that way, but I just
You need to do it on a firm surface. So a bed, it's not going to work or like this. But for show, it'll be.
I do it every
easier.
morning for my knots. That it just works really well for that. So I
Yeah.
just lay in place, and I usually do my stretching while I'm doing this.
Oh
but
my
you can
goodness.
bring your
Hold on, Bob.
yeah.
You're there. Things are falling apart.
You can bring your elbows back like this and stretch like this. You can stretch this way, taking deep breaths while you're doing this, and over time, this will stretch those rusty hinges out,
Right.
as he calls them.
And Steve actually, I demonstrated this a couple years ago, and he said I did not do the arm,
Right,
shoulder,
overhead.
yeah, and he sent an email to me. He said, make sure you add that, and I did, and it does help.
It does help,
Yeah,
right?
yeah.
And he's got a couple other suggestions in there. He's
Yeah.
got some strengthening exercises too. But again, you may have to have a pillow under your head to start, and you might have to have a towel because it might just be too much for you. Your posture may be
Yeah,
not able to tolerate.
so you just fold up a towel in 3 or 4 layers, and
You want to say loyal?
yeah, so the towel thing, it doesn't have to be a big towel. It might be too big. A smaller towel, get 3 or 4 layers of the towel to put over that, and it acts as a cushion if it's a little uncomfortable. Which exactly what I did.
Now this is a bit pricey,
Yep.
but especially you try tennis balls first and it works out. I would definitely, invest
Yeah.
in
Well,
this.
before I got this, I tried a softball, a little bigger
Sure.
diameter, and it was pretty hard. I had to put a towel over it, and it works okay, and you can certainly try it. And then I went to this, and if the softball works or you get something, it'll be worth it to get one of these because
Right.
it's going to last forever, and it's just more
you can
comfortable.
break this if you tried, and it's got a nice little soft. What do you call that?
The cushion, yeah.
Yeah, the
So, you can take that off and
Right.
clean it up if you'd like. This is the backbone of it, if you will.
Yeah, I asked him how he ended up designing it, and he had a designer friend, and they, it really seemed like the right amount.
Yeah.
It was the perfect amount, and I've given these away to a lot of people I know, Brad. A lot of people.
Did they use them?
Yes. I had a friend that he uses it because of golf. He was
Sure.
It's helped
Yeah.
increase his range
Yeah,
of motion.
Exactly.
So
And I don't know how they came up with the color, though.
yeah, I don't know either.
Maybe we should write a note to Steve.
Yeah, get a
Maybe-
different color. Oh, one last thing I want to mention, Brad. There's also called Tietze Syndrome.
Yep.
And that's usually when you have the pain just on the upper 2 ribs,
Okay.
but it's still costochondritis.
Just a
Yeah.
more specific
Yeah,
location.
it was. He did all the research on it. It was a specific location
Yeah.
and usually a little more inflamed.
So in that case, you're going to use whatever tennis ball or this up higher,
Yep.
closer to the neck to
Yeah.
treat that area.
Yep. Very good.
Yeah.
All right,
Wow.
check it out. Again, make sure you go to the doctor first.
Oh yeah, you
Don't
mean for
make
the
me-
chest pain?
Right, for the chest pain.
Absolutely. Get that heart problem completely out of the way.
All right. Take care.